A 14-year-old suffering from a 10-pound tumor on his face is set to undergo life-saving surgery to remove the mass before it suffocates him. Emmanuel Zayas, 14, was born with polyostatic fibrous dysplasia, a condition that replaces tissue with bone causing deformities of the legs, arms and skull. What he thought was a zit on his nose at age 11, was skull bone growing from his upper jaw into a basketball-sized benign tumor that has severely affected the way he eats, sees and talks, leaving him unrecognizable. Though the tumor is non-cancerous, it is life-threatening because if it continues to grow, the size will suffocate him and the weight will fracture his neck. Dr. Robert Marks of University of Miami Health Systems will lead the surgery to remove the tumor next month and told Daily Mail Online, in addition to improving his vision, airways and ability to eat, we hope the surgery will give the boy back his identity. Emmanuel and his family have flown from their native Cuba to Miami on a medical visa to undergo surgery that will save his life next month. His condition causes bone to grow where tissue should, and in this case, has grown from his upper jaw and consumed his face. It is a genetic deformation and it is unknown what causes the anomaly. Emmanuel can only breathe through his mouth and is extremely malnourished because the growth makes chewing difficult. The tumor is so large that it blocks his vision, leaving the boy only able to look up and to the side. In addition to the tumor, his condition also causes fractures and curvature to his arm and leg, leaving him unable to walk. Two months ago, Dr. Robert Marks came across Emmanuel's case and immediately offered his help. He will lead the surgery next month with a team of 4 doctors who will spend 10 to 14 hours to completely remove the mass. Dr. Marks said that the two big risks of the surgery will be bleeding and compromising Emmanuel's airways. Emmanuel first started to show signs of the condition at the age of 2 when his leg and arm began curving and outward. Doctors in Cuba were able to control his symptoms until the age of 9 when his skull began to swell and deform. More medication quelled the deformities. But for the last 3 years Emmanuel's parents have been desperately seeking medical help for their son as the tumor continued to consume his face. This not the first time Dr. Marks has treated a facial tumor of this size. He is one of the few doctors in the U.S. who specializes in operating extreme-sized tumors, including the internationally known cases of patients Lai T. Dow, who had a 12-pound face tumor, and Marley Cassius, whose tumor weighed 16 pounds. Dr. Marks and his team are donating their time and skill to Emmanuel free of charge. However, there will need to be follow-up surgeries to reconstruct Emmanuel's face, for which the Jackson Heath Foundation is fundraising. Emmanuel's next surgeries will take bone from his hip to reconstruct part of his cheekbone, upper jaw and nose. He will need teeth implants because his current teeth are inside of the tumor and will be removed with it. Emmanuel's mother Melvis Vizcaino said, "It is truly a miracle of God that his pictures ended in the hands of Drive." Marks. I am so grateful he was willing to take the case. Emmanuel is scheduled to undergo his first life-saving surgery at Holt's Children's Hospital in January. IKF Wonder Fund, a Jackson Health Foundation program that helps critically ill children from countries around the world gain immediate access to life-saving or life-changing medical treatments, took Emmanuel's case.